Hello guys, so our topic for this week are your non-protein nitrogens, your NPN. Guys, your NPN are important analytes in assessing your kidney function. Yan, wag niyong kakalimutan na your kidney function. So class, your CREA, your blood urea nitrogen, class, itong dalawang to, napaka-important for kidney function. Yan. However, we also have uric acid and ammonia. Pag narinig nyo ng uric acid class, it's best for gout. At ang ammonia, best for liver. However, they are all absorbed, they pass through the kidneys. So, basta, yan, yan kaya for kidney, uric acid usually for gout, kung may genetic disease, and ammonia pang liver, okay? Simulan natin. So class, these are tests for renal, for your renal function or renal flow, yan. So class, 45% of your NPNs are your BUN, your blood urea nitrogen, no, line E, yan, 45%. 20% are your amino acid, yan. So yung discussion natin, last meeting, 20% are your blood uric acid, creatinine 5%, creatine 1 to 2%, ammonia is 0.2% of your that pass through your kidneys. Yan. And the percentage of your NPN. So, simulan natin sa blood urea nitrogen. Yan. So, class, your blood urea nitrogen is a major end product of dietary protein. So, class, if upon the breakdown or catabolism of your protein, ang end product is blood urea nitrogen. Class, ang tanging source ng katawan ng nitrogen ay mga protina. So, proteins are very important in your diet. Yan. So, class, the ratio between the normal ratio between your BUN is to CREA is 10:1 to 20:1. So, ibig sabihin guys, sa bawat isang CREA, may 10 to 20 BUN. So, bawat isang CREA, may 10 to 20 BUN. So, mataas ang concentration ng BUN natin sa ihe, sa serum. First metabolite to elevate in kidney disease. So guys, once you will see blood urea nitrogen in your requisition form, inaabot na sa isip nyo na ina-assess ng doktor ang kidney function ng pasyente. It is easily removed by dialysis, indicator of nitrogen intake and hydration. So class, you have to remember that sometimes if nitrogen is increased in the patient, there could be increased protein diet. It's very much influenced by diet. Yan. Ang BUN. So yun yung upside niya. Na kung mataas ang protein intake, pwedeng tumaas rin ang BUN. Kung mababa ang protein intake, mababa rin ang BUN. So it's not only influenced by kidney disease, but also diet. Yun lang. Yun. But class, madalas naman, pag mataas ang BUN, sa clinical setting, dahil naman sa talagang kidney disease yun. So unless talaga it's really apparent that the patient has eating problems, gano'n, malabsorption problems, ayun, dun implicated na hindi kidney disease. But, BUN most of the time, kidney disease talaga yan. And to get the percentage of your urea, simply equals dapat to, BUN times 2.14. Yan. So to get the urea, so simply multiply your BUN times 2.14. Okay. So now let's focus on the methodologies on detecting your urea. So isn't it that you remember we have Nessler's reaction? So Nessler reagent reacts with ammonia. So first you have to get the nitrogen and break it down to ammonia, tapos react it to Nessler reagent. Yan. We have Berthelot reaction. So here we use urease. Yan, hydrolysis of urea with urease followed by some process that quantitates the ammonium ion. I'll show you the equation later on. And we also have glutamate dehydrogenase coupled enzymatic reaction. So we utilize urease and glutamate dehydrogenase. So class, pag may nakita kayong DuPont ECA analyzer, ang principle ng makinang yun ito, coupled enzyme reaction. So urease plus glutamate dehydrogenase. So class, the decrease in absorbance, it measures the product NAD at 340 nanometers. Tignan natin. So class, this is the normal, typical Berthelot reaction. So upon the, so with urease, your enzyme, it hydrolyzes urea into ammonia and carbonate. So now, ang responsibilidad na natin is to measure the ammonia via Nessler's reaction, via Keldal reaction, and so on. Pag may coupled enzyme reaction naman, so the ammonia is reacted to 2-oxaglutarate plus NADH. So with the enzyme glutamate dehydrogenase, the products are glutamate and NAD. So yung NAD sa spectrophotometer, ito yung binabasa na product at 340 nanometers wavelength. Okay? So pag Berthelot reaction lang, itong first reaction lang natin. Itong first chemical reaction. Pag glutamate coupled enzyme method, itong dalawang reaction. Okay? So pag may DuPont analyzer, yun yung principle dun sa makinang yun in determining urea. Okay. We have other tests like conductimetric method. So pag may Beckman naman, ito ang ano naman niya, ang principle niya is conductimetric method. So the measurement of conductivity. So class, so itong mga to may mga charge sila. So they conduct electricity from the reaction of urease on urea producing ammonium ions and bicarbonates. So yon, measuring the conductivity. We have urograph or urastrat strip. So based on chromatography and Conway microdiffusion method, and we also have indicator dyes, parang sa protein natin. This is used in Kodak Ektachem analyzer. So depending on the machine, iba-iba yung principles nila. So dye is added to ammonium ions from the hydrolysis of urea, and the color change is measured. Okay. Yeah. We also have this direct method, which is DAM or Freon method. So urea plus DAM, diethyl monoxide, will form a yellow diazine derivative yan. So ito yung minimeasure spectrophotometry. And class, the reference method for urea is isotope dilution mass spectrophotometry. So yan, we are measuring the isotopes. Mamaya, tingnan natin. I think I defined it sa kaya. So mostly sa NPN, ang reference method is ito, IDMS, isotope dilution mass spectrophotometry. So class, expect your BUN to increase if there are chronic renal diseases, stress, and if there's burns, high protein diet. So ways on there's increased nitrogen in the body. Yan. And for nutrition, like what I said, or impaired absorption, doon lang bumababa ang BUN. So unless that the patient is malnourished or have a malabsorption disease like celiac or sprue, and yun, decrease ang BUN. Yan. We have this terms class, azotemia and urea. Yan, azotemia and uremia pala, urea. So sa uremia class, elevated. So when a person has uremia, itong tatlo, yan, elevated ang urea, increase, may hyperkalemia or increase ng potassium, at acidemia ang pasyente. Yan. So, urea, potassium, yung tatlong lang. Pero pag azotemia class, halos lahat ng NPS, increase. Okay? Pag uremia, urea, potassium, acidemia. Hindi lang urea, may potassium, may acidemia rin. increase acidity. However, pag azotemia, lahat ng NPNs, including your BUN. So we have three types of azotemia. We have pre-renal azotemia, renal azotemia, and post-renal azotemia. So madali lang to, guys. So pag renal azotemia, may mali sa renal function. Pag post-renal azotemia, there's a blockage or obstruction in urine flow. In pre-renal, walang mali sa sa kidneys, guys. But there is reduced renal blood flow. Example class, hemorrhage, dehydration, increased protein catabolism, shock, and congestive heart failure. So class, pag sa pre-renal, there's nothing wrong with the kidneys, but there's something, there's a pathology before it passes through the kidneys. Example, hemorrhage, bleeding, dehydration, yan. Mukhang nagtumataas tong NPNs natin. Yan. Kasi nga pag hemorrhage, there's increased bleeding, yan, increased protein catabolism, increased breakdown of proteins. Isn't it your NPN are from the breakdown of protein? If there is shock, yan, hypovolemic yung pasyente, there is congestive heart failure, yan, pre-renal azotemia, wala pong mali sa kidney. That's why expect a normal glomerular filtration rate. So GFR is an assessment of your kidney function as well. Next, renal, there's something wrong with your kidney. That's why decrease ang glomerular filtration. Glomerular filtration rate. Yan. Decrease ang glomerular filtration rate. So, may kidney disease. Yan. It's renal azotemia. So, expect elevated ang NPN mo pag may kidney disease, isn't it? And class, nagpapataas rin ang NPN pag may obstruction sa urethra, sa ureter. In cases of calculi, kidney stones, tumor in the bladder and the prostate. Yan, napapataas niya rin ang NPN kasi na-obstruct hindi nare-release sa the urine. Yan. So, yan. So, yan please. Yan, take note ha. Azotemia versus uremia. So, reference levels ng BUN class. So, sa adult, 60 to 20 milligrams per DL. Sa urine, 12 to 20 grams per day. So, class, kung ang conversion factor ng glucose into millimoles is 0.055, yan, sa conversion factor naman ng BUN is 0.357. So, for processing your BUN, so, madalas serum ang ginagamit natin. So, gold tube, red tube. Do not use fluoride and citrate because it will inhibit your urease. If you're going to use bertholot, yan yung mga Kodak natin. Fasting is not required. Yan. So far naman sa NPN class, fasting is unnecessary. Yan. And non-hemolyzed sample, syempre dapat. Thiocarbazide and ferric ions are added to enhance the color development in spectrophotometry. Okay, let's head on to your creatinine. So, your creatinine, guys, so, galing siya sa metabolism ng creatine at creatine phosphate. Your creatine and creatine phosphate class power up your muscles. Yan, they power up your muscles. And what's good about your creatinine class, it's not affected by protein diet unlike your BUN. Yan. So, it's very stable in your serum. It's very stable in your urine. Creatinine is inversely related to your glomerular filtration rate, and it's commonly used to monitor renal function. So class, ang advantage ng creatinine, it's not affected by protein diet. However, class, ang disadvantage naman ng creatinine is it's affected by your muscle mass. Yan your muscle mass. So if the patient class has muscular diseases, pwedeng tumaas ang creatinine. Yun lang. Yan. Tataas ang creatinine class if there's something wrong with your renal function. However, tataas rin siya pag may mali sa muscle mass. Yun ang disadvantage, class ng creatinine. But class, still, BUN and CREA are utilized in assessing kidney function. Huwag kayong malilito ah. So, class, ang mga analytes, may mga caveat sila. Ibig sabihin, hindi sila perfecto talagang nagme-measure ng kidney. So, ito, creatinine, naapektuhan ng muscle mass. So, kung may polio ang pasyente, may muscular dystrophy, pwedeng umangat ang creatinine. Ang BUN naman, kung there's something wrong with protein diet, pwedeng maapektuhan ang BUN. However, class, pag ginamit mo silang dalawa, if you would take the BUN and creatinine ratio, mas magiging reliable sila. Yan. So, class, kaya nga, kidney function test eh. So, we are using different analytes to assess your kidney. Yan. So, marami tayong ginagamit. So, kino-correlate natin itong mga analyte na ito, itong BUN, itong CREA, to assess the health of your kidney. Yan. So, yan, creatinine clearance is a measurement of the amount of creatinine eliminated from blood by the kidneys, and GFR are used to gauge renal function. Sabi nito, creatinine is used to evaluate the completeness of 24-hour urine collection. Yeah. So, just to check, plus, kung tama yung pagkolekta ng pasyente, we could use the creatinine levels yan, to assess the completeness of 24-hour urine collection. So, when we say 24-hour urine collection, literal class, the patient should get a usually, ang lalagyan dito sa Pilipinas, lalagyan ng mga IV o kaya 1.5. So, for the next 24 hours, kukunin ng pasyente yung lahat ng volume, lahat ng urine niya for the next 24 hours. And to assess kung tama yung pagkolekta nila, we could check the creatinine levels in urine. So, serum and urine, creatinine are indices for renal function, both the serum and creatinine levels. Specimen does not need fasting, just like your BUN. Hemolysis and ecteric specimen must be avoided. So, yun, yung CREA natin, it's affected by muscle diseases, hyperthyroidism, trauma. Ayan. So, class, magkakalimutan. Pag narinig nyo na yung Jaffe, Jaffe, so sa CREA lang ito. Yan. So, the principle of Jaffe is the creation of a yellow tautomer or red-orange tautomer that is red at 510 nanometers. So, creatinine plus alkaline picrate, yan, equals creatinine picrate. So, ito yung yellow tautomer, red at 510 nanometer. Class itong Jaffe reaction, ang disadvantage niya, maraming interference na nakaka-apekto sa function niya. So, class, para mabawasan yung interference, marami silang modification na ginawa. First, one is your kinetic Jaffe method. Yan. So, when we say kinetic, so dalawang beses, 2 to 3 times nire-read at a certain time interval. So, hindi lang nire-read yung reaction once. So, it's measured, sabihin natin, every 1 minute, 3 times. Yan. So, after 1 minute, i-read. After next second minute, i-read na naman. Tapos, third minute, i-read na naman. Because we are measuring the rate of change in absorbance. Yan, rate of change in absorbance. So, same pa rin, pero ang minimeasure natin, yung rate of change. Yan. This is rapid, inexpensive, and easy to perform. And there are less interferences. Dalawa na lang ang interferences. Keto-2-oxo acids and cephalosporins. Yan. So, if you're taking these drugs, it could affect your kinetic Jaffe method. Nabawasan. Yan. Another modification of your Jaffe method is Jaffe with absorbent, called Lloyd or Fuller's Earth method. So, yan, it's more sensitive and specific because there is an absorbent. Yan. So, the interferences are absorbed using your Fuller's Earth, ang ganda ng pangalan, Fuller's Earth, and Lloyd's reagent. Yan. So, pinapa-absorb natin para mabawasan yung interferences. However, this is very time-consuming. It's not yet automated. Kaya mas reliable sa laboratory ang kinetic Jaffe. Yun yung ginagamit ko when I was working in the laboratory. We also have coupled enzyme reactions. So your coupled enzyme reactions, if you have a dry slide analyzer, ang principle ng mga dry slide analyzer in measuring creatinine is your coupled enzyme reaction. So your creatininase is coupled with creatine with CK class, sorry, CK to. Your creatininase is coupled with sarcosine oxidase. Your creatininase is coupled with peroxidase. And class IDMS rin ang reference method ng creatinine. So for clinical significance, so expect when there is renal function impairment, chronic nephritis, yon muscular diseases, increase ang creatinine. In cases of decreased muscle mass, yan, severe liver disease, pregnancy, inadequate protein diet, decrease ang creatinine. Class ang conversion factor ng creatinine is 88.4. So here is the reference range. Okay, class. So this is for this part. We'll tackle here the BUN is to Crea ratio. Yan. So, getting the ratio of the two is very important because it also points out where the dysfunction is coming from. So here, example, ito, low BUN is to Crea ratio. So if the ratio is less than 10:1, yan, lower, yan, it points out not really it points out to low protein diet, acute tubular necrosis. Pag mababa ang BUN, yan, so tubular necrosis, ibig sabihin, so there, hindi nare-reabsorb ang BUN at CREA. So, talagang nare-release siya sa urine, repeated dialysis, and hepatic disease. So, mababa ang BUN at CREA. Okay, next class. High BUN and CREA ratio with normal creatinine. So class F, the creatinine is normal. However, there is high BUN and CREA ratio. It points to pre-renal azotemia. So this is not really kidney function imbalance or disorder. So there's something wrong with hydration. So dehydrated yung pasyente. Baka may congestive heart failure or hemorrhage, di ba? Dun sa pre-renal azotemia. Or, yun, hemorrhage. Ito naman, pag increase ang CREA, dito talaga ang renal disease at saka post-renal azotemia. So, at yun, at post-renal obstruction. Renal and post-renal azotemia. So, mataas ang CREA, mataas ang BUN, mataas ang ratio. Okay? Let's head on to your uric acid or blood uric acid. So, upon the breakdown of nucleic acids, so class yung nucleic acid natin nanggagaling sa nucleus. Ang mga nucleic acid sa nucleus, class, your DNA and RNA. So, class, may purines itong mga to. Kung naalala niyo sa cytogen, class, may purines at pyrimidines. So, galing sa nucleus tong mga to. So, pag nagbe-breakdown itong mga DNA, itong mga RNA, itong mga nucleus class, ang end product ng catabolism nila class are uric acid. So, yun, if you are eating class, yung matataas ang mga nucleic acids, yun nga, broccoli, yun matataas daw uric, mga class laman loob, mga papaitan, mga seafoods, mga laman loob, legumes, beans, yan, mataas ang uric acid daw nitong mga to. So class, upon excess uric acid class, it could deposit in joints and tissues, and it could result to inflammation, class, masakit. Yan. So class, yun, it could result to gout, gouty arthritis, and so on. Yan. And actually, it could affect the kidneys. Yan. Class, ang uric acid, class, it's reabsorbed in the proximal tubules of your kidney and reused. Yan. So class, uric acid is actually not a really reliable test for kidney function. Mas reliable po ang Urea at BUN. So here are your reference ranges and your conversion factor is 0.059. Yun, kailan ba tumataas ang uric acid? Yun, pag may increase intake of uric acid, example, yun, gout, increased nuclear metabolism. So, itong mga sakit na to, class, leukemia, lymphoma, multiple myeloma, polycythemia vera. So class, ang pagkapare-pareho ng mga sakit na to is there are excess production of cells, abnormal and excess production of cells. Class, leukemia and lymphoma are blood cancer. Also multiple myeloma. Isn't it, class, pag cancer, di ba? Masyadong maraming production ng abnormal cells. Yan. Abnormal cells, excess production of abnormal cells. So class, leukemia are cancer of the blood. Leukemia are the cancer of your WBCs, your lymphoma are, ang naapektuhan dito, class, are your lymphocytes, multiple myeloma ang naapektuhan dito, plasma cells, excess tong mga cells na to. So class, ibig sabihin, pag excess tong mga cells na to, namamatay rin naman sila. So upon their breakdown, class, tumataas ang uric acid. Pag polycythemia vera, ang opposite ng polycythemia vera, class, is anemia. So pag may polycythemia vera ka, increase ang red blood cell, increase ang WBC, increase ang platelet. So class, pag nag-breakdown itong mga cells na to, there is increased catabolism, increased breakdown of purines, larami ang uric acid ng mga pasyenteng ito. Yan. And we have chronic renal diseases, and we have Lesnihan syndrome. Yan, napaka-interesting nitong Lesnihan syndrome. Class, this is an X-linked recessive disease. Actually, this is a rare disease, which are only men who are affected and women are carriers. Pag nagkaroon man ang babae ng Lesnihan, carrier lang siya ng gene na yon. She doesn't exhibit signs and symptoms. However, class, pwede siyang magkaroon ng lalaking anak na magkakaroon ng Lesnihan syndrome. Actually, this is a rare genetic disease. At ang mga may Lesnihan syndrome, class, matataas ang uric acid. They are prone to gout because of their deficiency of HGPRT enzyme. Yan, kayo na lang mag-search ng HGPRT enzyme. In class, alam nyo, ang isa pang interesting sa Lesnihan syndrome is they are prone to self-mutilation, yung mahilig silang nagbabite ng nails. Meron kasi sa personality disorder, sinasaktan ang sarili nila, self-mutilating tendency, personality disorders. Yan. So, ang isa sa key characteristic na may mga Lesnihan syndrome, so this is a genetic disease which is an X-linked recessive. So, women are carriers, males are the one that exhibits the symptoms. Yan. So, in cases na mababa naman ng uric acid, we have familial renal hypouricemia, Fanconi syndrome, defect in proximal tubule leading to malabsorption. Ayan. So, hindi na re-absorb ng proximal tubule yung uric acid. Hence, nagpapass through sa urine, di ba ang baba yung uric acid sa circulation. And we have Wilson's disease. So first, we have uric acid determination. Itong phosphotungstic na to, ito ay isang redox reaction or reduction oxidation. So, uric acid plus phosphotungstic acid with our chemical sodium cyanide or sodium carbonate will result to tungsten blue, Alantoin plus carbon dioxide. So class, sa board exam, ang alam ko, ang pinaka-familiar sa akin dito is itong caraway. So pag narinig yung Caraway test or method, it's a uric acid determination. So Archibald Henry Caraway, sodium carbonate yung ginamit nila instead of sodium cyanide. Pauline Newton Brown and Benedict, sodium cyanide naman. Yan. So pag narinig yung Caraway, yan. Phosphotang stick. Tapos class, ang end product na minimeasure is Alantoin. Next is enzymatic method. So, Alantoin pa rin yung end product. Yan. And the enzyme that's used is Uricase. Yan. Dapat ilagay natin dito sa taas ng arrow yung Uricase. Yan. So Alantoin is measured at 200 nanometers. Yan. Simplest and most specific. Yan. I think this is a candidate for reference method. So class, ang ginagamit natin as specimen, pwedeng heparinized, pwedeng serum, pwedeng urine. Yan. So as much as possible, class, sa lahat naman ng test, you should separate your serum and red cells immediately. Fasting is also unnecessary, and your uric acid is pretty much stable. Class, if you are measuring uric acid in urine, it should be at alkaline level. We don't use EDTA and fluoride, so serum lang and heparin. Falsely decrease in hemolysis, high bilirubin, increase in salicylates and thiazides. And finally, guys, we are now in ammonia. So class, ammonia, so from the catabolism of amino acids. So class, ammonia is also affected by protein diet and by bacterial metabolism in the lumen of the intestine. So yun, if you don't have enough bacteria in the intestine, especially kunyari immunosuppress ka or excess intake of antibiotic, yun, pwedeng bumaba ang bacteria. Plus, ammonia is more reliable in your hepatic failure and Reyes syndrome. Plus, Reyes syndrome is very interesting. Ito, rare genetic disease rin to, which affects children about 4 to 12 ages. It affects the brain and the liver. Yan. So, to assess the prognosis, yan, kung mabubuhay pa ang pasyente, plus if it's a good prognosis or a bad prognosis, they assess ammonia. So, Reyes syndrome is usually happens, this is a rare disease that happens after viral infection. Yan. So, class, like, example, varicella, nabasa ko eh. So, pag kunyari, nagka-varicella yung bata, isa sa komplikasyon nito, wag naman sana, is Reyes syndrome. So, it could result na it would affect the brain and the liver. Yun. So, hepatic failure, yun, inherited urea cycle enzymes affects your ammonia levels. Yan. Severe liver disease, ammonia is used for prognosis. Yan. Especially arterial ammonia. So, these are a few tests in assessing your ammonia. We have ISE, ion selective electrodes. We have spectrophotometric and glutamate dehydrogenase. Okay, basta na lang. So class, arterial ammonia, so we could collect arterial blood that should be transported in cold, in ice. Yan, sa ice. So, yan. So, we could get here in the radial pulse or radial artery, pwede dito sa brachial artery, pwede sa inguinal artery. Ayan. So, yun, if you cannot assess the arterial ammonia as soon as possible, keep it under ice. And class, the best thing to use is heparinized syringe. Yung bibili na syringe, it's already coated with heparin. Yeah. But back then, ako manual kung kino-coat yung syringe ng heparin. Yeah. Which is prone to being over-heparinized. Kaya mas maganda bumili ng heparinized syringe. So class, your ammonia is sensitive with the environment. So make sure that there's no tobacco smoke, urine, ammonia in your glassware, reagents, and water. Yan. And the reference rate, sobrang konti. 19 to 60 micrograms per dl. Yan. So guys, thanks for listening in our NPN discussion. I'll see you again.